Good afternoon, and thank you for being here. I'm New York State Attorney General Eric Schneiderman, and I'm here today to talk about a new report that my office has issued providing a lot of details about a program that I'm very, very proud of and that it's important that we publicize, which is a program to help New Yorkers to solve problems with medical bills, health insurance, and medical debt through our Health Care Bureau Helpline. And I'm joined by Lisa Landau, the head of our Health Care Bureau, who's the mastermind behind this extraordinarily successful project. I'm also proud to be joined by my outstanding colleague in government, Senator O'Brien, as well as some of our consumer advocates that are our allies and that really form a network with us to protect consumers from problems related to the healthcare system. Trilby DeYoung from the Finger Lakes Health System Agency, and also Gregory Hale from the Empire Justice Center. I'm very pleased that they're here, and I'm also pleased that we're joined by Patricia and Matt Robben from this area, who are going to talk about their own experience calling the helpline. And I think it's a very important example for what you can do when there's an unfair denial of coverage. I think it's very important that we get the word out about this, and I just really want to emphasize that we've been here before to make sure that hardworking men and women in Monroe County and all over Western New York know that the Office of the State Attorney General, through our Homeowner Protection Program, is here for you when you're dealing with issues related to foreclosure and housing. We've been here before to make sure that the families and workers out in Monroe County and Western New York know that our Labor Bureau is here for you if your employers are trying to cheat you out of a fair day's pay for a fair day's work. We've helped tens of thousands of New York families deal with foreclosures, and we've recovered over $18 million for 14,000 workers through those two programs. And today, we're issuing this report to make sure that all New Yorkers know that we also are there for you when you have problems with your health insurance or with health care providers. The report we're issuing, which is called Real Solutions for Real New Yorkers, is an important document, and it's particularly important right now because October 15th is the beginning of the open enrollment period for Medicare, when people have a chance to make changes in their coverage, and November 15th is the beginning of the open enrollment period for the health care exchange under the Affordable Care Act. So we want to make sure that New Yorkers are well informed, and our health care hotline provides free help if you receive a medical bill that you believe contains an error, or your insurance company denies a claim that you believe should be covered. Call our office, and the number's on the report, 800-428-9071. I think it's also over here on the sign. And New Yorkers should feel confident to call our hotline because they've provided extraordinary service and been extremely effective in thousands of cases. And as set forth in detail in the report, in the last 3.5 years, our Health Care Bureau Helpline has assisted more than 20,000 New Yorkers who had questions or problems with medical care. They've secured more than $12.5 million in restitution and claim payments for New Yorkers. And as I will discuss, we've helped many more New Yorkers because health care hotline complaints sometimes lead us into discovering systemic problems that are where there are companies that are hurting tens of thousands of New Yorkers, and I'll talk a little bit about that later. But the most important thing is for people to understand that help is available. It's a trustworthy source of important information. We can intervene and solve problems, and we have saved many New Yorkers thousands and thousands of dollars and helped with problems that are extremely common in New York State. We are here, and we're here as a part of a network with our advocacy organizations and our colleagues in government, because it is incredibly difficult for the average New Yorker or the average American to navigate the complicated geography of our healthcare system in 2014. And this report is being issued to send the message, you don't have to figure this out alone. And so the most common problems that we hear about are billing errors by healthcare providers, delays in processing insurance claims, and improper denials of claims, which should not be surprising because almost everyone I know has had one or more of these experiences. It's extraordinarily common. You get a medical bill for more than you expected, or for something that you thought your insurer was going to cover. You're told that something that's a necessary medical treatment at the time you have to have it provided was not covered. And everyone has had the experience, if you've tried to deal with the system, of waiting on hold, navigating through endless phone trees and menu options, often to get an answer that is unclear, or sometimes to get no answer at all. So that kind of runaround is stressful for anyone. But for a family with limited means, particularly looking at a medical emergency and a bill that they know they can't afford to pay, this is terrifying. And it's very important to understand the degree of this problem. Medical debt is the leading cause of bankruptcy in the United States. And there's been a lot of work that we've done in our office on mortgage debt, on student debt, and other things. But medical debt is actually the worst. This is what drives more people into bankruptcy than anything else. And more than 3/4 of the people driven into bankruptcy by medical debt actually have health insurance. So it's a matter of making sure you get what the insurance company is supposed to pay. It's critical that you know where to call for advice and where to look for advice. We had one case in which the patient was billed more than $200,000 because the insurer improperly denied a claim. Our advocates intervened, and within 3 weeks, the insurer paid, relieving the patient from debt that probably would have caused financial ruin for the family. And it's not always about money. We're helping patients whose access to life-saving treatment is at risk because of paperwork problems and delays. In one case, a brain cancer patient receiving chemotherapy and stem cell treatment was informed by his insurer 2 days prior to the scheduled treatment that he'd lost his coverage. He was on COBRA and had submitted his premium check to his employer, but his employer was late in sending documentation to the insurance company. Our advocate contacted the insurer and convinced them to expedite the process, and within 24 hours, that patient got the go-ahead to have the treatment that he needed. I should note also that October is Breast Cancer Awareness Month, and we have had quite a few cases helping breast cancer survivors to get care they need. We have seen and heard from and helped patients scheduled for breast reconstruction immediately following a mastectomy when their insurer rejects a claim for this service. In one case, the insurance company rejected a woman's claim because they said you're not allowed to go to an out-of-network provider. Our advocates got involved and pointed out to the insurance company that they had no in-network providers available for this surgery, and we were able to secure an exception for that patient who got the care she needed. As I mentioned, the helpline is also a great source of information for us to identify broader problems that are harming thousands of New Yorkers at a time. We received a lot of complaints about GE's Care Credit medical credit card, including complaints of high-pressure tactics, sometimes when people were in the office of a healthcare provider, large upfront charges, and our office reached a settlement that required sweeping new protections to make sure these things don't happen again, and we are monitoring this settlement. In another case involving improper denials for mental health and substance abuse treatment, which is unfortunately all too common, we were able to reach a settlement requiring an independent review of more than 15,000 claims that were denied and that we think were wrongfully denied. So that could result in as much as $31 million being returned to New Yorkers who were wrongfully denied benefits. Those are just a couple of examples of the broader enforcement actions that grew out of helpline complaints, but it's a simple process. If you hit a wall, and the chart behind Lisa really tells you everything you need to know, you can contact someone, and our advocates can help you understand your benefits, explain the appeals process for a denied claim. In some cases, they can serve as a mediator with your provider or insurer. In some cases, if we find that there's a violation of law, they can refer it to attorney. They also are really very, very knowledgeable about other offices and agencies with particular expertise or jurisdiction. And as I said, when we get into this Medicare open enrollment period, there are folks with expertise on Medicare who can help guide you through this. New Yorkers just have to know how to have access to them, and that's another role that we serve. And we also are always on the alert for bigger systemic problems by healthcare providers or insurers who are abusing the system in a systematic way. So I'm very proud of the work that our Healthcare Bureau has done on this. I commend them, and I think if you read this report, you will agree that the helpline is just a great example of effective and efficient government at work, making a difference for real New Yorkers. And I'd now like to bring up two people who can describe their own experience. Patricia and Matt, welcome, and please come up, and if you would share your story, that would mean a lot to us.
Thank you very much. Our story started back in February when our daughter Emily, who was a senior in high school, came up with incredible back pain. We had no precipitating injury to the back pain, and but it laid her out flat. This is a child who, when she was younger, did gymnastics and vaulted on a broken ankle. She has incredible pain tolerance. So for somebody like her to come up flat on her back with back pain and numbness and tingling in her hands and feet, we really panicked. We took her to the pediatrician, who said, we're really not sure what's going on, but call us back if you have any further questions or if the pain gets worse. Well, Saturday morning comes along, and sure enough, the pain is worse. We called the pediatrician, and they said, well, there's really not a lot we can do over the phone with you. Take her to the emergency room. So we took her to the emergency room, and we were assessed at the emergency room. She was given x-rays and the usual workup. Fortunately, by the grace of God, they found nothing dramatically wrong with her because there was a consideration of a spinal fracture at the time. And they sent us home with a prescription for heavier duty pain medication and need to follow up with a specialist, which we did. And long story short, she needed 4 months of physical therapy to get back on her feet, and is now in Switzerland in college doing great. But about a month and a half after the emergency room visit, we received notification from the insurance company that the emergency room visit was not going to be paid as it was deemed medically unnecessary. They had paid the doctor bill for the emergency room and the radiologist, but they weren't going to pay the facilities charge, which was quite a bit of money. And we really didn't know where to go with that because the pediatrician had told us to take her to the emergency room. We really felt like at that point it was, in fact, medically necessary. We were really scared. I didn't know what to do. I tried calling the insurance company multiple times. I called the pediatrician. I called the billing department at the hospital. Fortunately, I got a lovely woman at the billing department at the hospital who told me to call the Attorney General's office. I did not know anything about the Health Helpline at the time, and I was so grateful that she told me to call. I called the helpline, and without too much optimism, to be frank, someone answered the phone. She answered the phone. She started a case file that very day, told me what documents to gather and what information I needed to provide, which I did. They interceded on behalf of myself and my husband with the insurance company, and the bill was in fact paid because it was the insurance company's decision was changed. And it was really, really a great thing for us. 2 kids in college, that bill was not happily received. So we were really, really pleased with our experience with the helpline, and I'm so glad to be here today to get the word out about it because as was mentioned, it's impossible to navigate insurance company rules and regulations as a layperson, and to have help with someone that really knows what they're doing and can help you in a way that's meaningful is really, really important.
Thank you. Thank you very much. Thank you. I appreciate you for sharing that. This story is all too common. We see a lot of examples of a doctor, or in some cases first responders, telling people they have to go to a particular provider. In one case, there was a badly injured child that had to be transported by air and the first responders are the ones who told the parents they had to do that, and then the insurance companies come back and say it's not medically necessary. So a lot of people are either don't know about our Helpline, and also, frankly, there are a lot of people who are kind of embarrassed to talk about medical debt and their inability to pay it or the problems they're having with their providers. We want to convey through this report, we want to get the word out, you don't have to go through this alone. There are more Americans entitled to more health care now under Medicare and the Affordable Care Act than ever before, but if you can't get your bills paid, if you don't know how to navigate the system, it doesn't do you any good. So I'm proud of the work that we've done in our Bureau, and I urge everyone to read the report, and everyone should know that you don't have to go this alone. So I thank you, and now I'd like to bring up a great colleague in government who's been involved in ensuring that in New York we do have one of the best healthcare exchanges in the country, Senator Ted O'Brien.
Thank you, Eric. You know, Attorney General Schneiderman and his office have provided an absolutely fantastic resource to our community and to communities all across the state. And he says that all too often experiences like Patricia's aren't the exception. There's a lot of people, and I know that from the volume of calls that come into our Senate office. People expect and deserve in New York have reasonable access to health care, and all too often they have all kinds of range of problems, either with their providers or, as been mentioned, with insurance companies. And some of them are more easy to sort through than others, but sometimes there's billing problems. Frequently it's whether or not their coverage denial was appropriate. And to have a resource like the Health Care Helpline for us in New York is an amazing tool. And you'll see already helped over 20,000 New Yorkers. So it's great to have the Attorney General come back to Rochester again to talk to us about another success and to start looking at the results that we have after the inception of the helpline. It's a tremendous resource. I know that many people in Monroe County have been helped by that, and I'm really delighted to stand with you today and talk about how people can really get assistance with navigating what can oftentimes be a confusing and difficult healthcare system. So thank you,
Thank you very
General.
much, Senator. Thank you. So we look forward to more success with our healthcare hotline. We look forward to more people in Monroe County and Western New York calling us, and we're very proud of the work we've done, and we hope that everyone gets this report so our network of advocacy organizations, local officials, state officials can continue to refer people to the hotline, and we can continue to help New Yorkers get the health care they deserve. Many of us believe that humane, affordable health care is a right, not a privilege, and we're going to do everything we can do to ensure that New Yorkers get everything that they're entitled to. And with that, we can take some questions.
Hi, Patrice Walsh from Channel 13 in Rochester. I don't know if you can answer this, but a lot of people are getting major increases in their health care insurance as we speak, and between some of the other carriers, and people are facing high costs. Can you say anything? I mean, obviously it's a tough time for people trying to afford everything, so obviously this service is something they definitely want to take advantage of if they have an issue, but just healthcare costs in general. I mean, you talked about medical, being the highest case of bankruptcy is medical debt. Maybe, I don't know if you can speak to
Well,
people are paying.
there are increased costs, and sometimes it is legitimate for a provider, for an insurer, to increase their costs. But sometimes it's not. And I think it's very important for people to understand that the cost of health care is going up in a lot of areas, but the idea of the Affordable Care Act, and tested and proven to be effective so far, is actually to bring down the cost of various parts of the healthcare system. So we encourage people to look carefully at the documentation they've got from an insurer. They are entitled to raise rates under some circumstances, but we want to make sure that it's done fairly. And there also are outfits that purport to be to provide assistance for people with these problems that aren't what they appear to be. This is true with mortgage debt. This is true in every area. And again, a lot of people don't realize how crushing medical debt is and the severity of the problem really all across the country. So we encourage people to ask questions, get the documentation, and we are there and we're able to provide them with information about who they should contact if we can't handle it, and if we can handle it, we will. Yes.
I was just wondering, is there a change in this year, this past year that we've had affordable care, we've had the exchange open, has it
Well, we definitely are handling more calls now than we were a decade ago. I think the number per year has gone up by 1,000 people per year, and Lisa's done a great job of organizing it. I think it's really more attributable to the fact that we're doing a better job getting the word out about the helpline, and our advocates are probably being more aggressive than ever. And the complexity of the system, yes, these additions, changes in Medicare, the Affordable Care Act, provide more benefits, but the system has become more complicated, so programs like this are more needed than ever. Okay.
Any other topics?
Thank you all.
Do you see a particular pattern or trend in the types of complaints you're getting in recent years compared to last year?
Well, I think that, the problem of denials of insurance coverage and delays in insurance coverage just continue to escalate. And it is important for us to get this information because we're always looking for patterns of misconduct in case there is a particular insurer, a particular healthcare provider that actually is doing something systemically to abuse the patients. And that's another very important reason why we need people to call the helpline. As I mentioned, we've had some examples of discovering problems that went beyond an individual case, and that's something that we're uniquely able to handle because our advocates can help individuals if that's possible. It's an individual issue with an insurance company or a healthcare provider, but we also can refer things that appear to be bigger problems or to attorneys in our office, and we can pursue them. Thank you very much. Thank you all.
Thank you. Thank you. Really appreciate it.